It's always a pleasure to be at this celebration. It's one of the most important parts of all of us from the Board of Trustees recognizing one of the main things that we do is educate tomorrow's doctors. Throughout your training, you've benefited from being part of an academic medical center that's operating at the very forefront of medicine. Since Mount Sinai was founded in 1852 to provide medical care to underserved communities in New York, innovation and giving back to the community have always been our hallmark. And they've gone hand in hand with Mount Sinai taking a bold long-term view of the needs of the institution and the community that depends on it. Today, Mount Sinai's leaders continue to look strategically at the rapidly evolving healthcare environment and seek out opportunities to better serve our communities and to push the boundaries of medicine. To these ends, we've made crucial investments in talent and in facilities that have enabled us to build a thriving academic medical research enterprise. In recent years, many of the world's greatest medical and scientific minds have come to Mount Sinai to conduct some of today's most compelling and innovative biomedical research, from developing immunotherapies for cancer to studying the molecular mechanisms of neurodegenerative disease like Alzheimer's. In particular, we've invested aggressively in genomics and in big data, two of the most powerful tools of 21st century medicine, which promise to reveal individual patients' unique genetic information in previously unimaginative detail. Armed with the plethora of information, our clinical researchers will be able to identify individual patients' diseases as well as develop targeted therapies. As a medical school which was born out of a teaching hospital, our deeply ingrained legacy of translational research will enable us to apply these breakthroughs in research and personalized medicine as quickly as possible to have clinical impact in real time. And likewise, from a patient care point of view, we have observed a huge change in landscape of medical reimbursements. And Mount Sinai has chosen to respond aggressively and proactively to the paradigm shift from a traditional fee-for-service reimbursement model, which incentivizes caring for people once they become sick, to a population health model that incentives keeping people healthy and keeping them out of the hospital. This shift is already driving transformative changes in the patient experience by delivering higher quality, continuous, and more coordinated care at lower cost to the overall healthcare system. While some medical centers have been slow to grasp the inevitability of these changes and the impact they have on the future practice of medicine, Mount Sinai has once again sought to be a leader. Over the past 2 years, we've taken bold steps to fulfill our vision of becoming the leading population health manager in New York City. We've created Mount Sinai Health Partners IPA, an independent practice organization, to promote collaboration among our clinical care providers and equip them with the resources to manage and improve quality of care for populations as well as for individuals. In addition, we've established accountable care organization partnerships with the Center for Medicare and Medicaid Services and Health First, Empire, and most recently Aetna, to improve care delivery and value for both patients and providers. These strategic investments, fueled by our organization's deeply rooted tradition of philanthropy and our commitment of giving back to the communities we serve, have cemented Mount Sinai's role at the forefront of healthcare delivery. Class of 2016, as Dr. Davis said, you are stepping into roles as leaders at the forefront of healthcare, and you couldn't be doing so at a more profoundly exciting moment. The promise of genomics and the bioinformatics will bear fruit over the next decade, utterly transforming how we understand and treat disease. And while there may be growing pains with as our healthcare system grapples with the transition to population health, in the long run, our patients and our communities will be healthier and better cared for, and we will finally begin to contain healthcare costs and build a sustainable healthcare system for future generations. These changes offer unprecedented opportunities to improve healthcare quality, efficiency, and equity for all Americans. Graduates, I encourage you to seize these opportunities. You need only harness the creativity and compassion that you've honed during your training here at Mount Sinai. Increasingly, you will be your patients' greatest advocates, and that is both an incredible privilege and an extraordinary responsibility. Knowing what you've accomplished so far, I have no doubt that you are all up to the challenge and that the generations of patients will benefit from your expertise and insight. So on behalf of the Board of Trustees of Mount Sinai, I congratulate all of you and I wish you great luck in the medical careers you choose as you go forward. Thank you.